Spotlight Chicago is sponsored by UI Health.
September is Aneurysm Awareness Month, and UI Health wants to educate you about when to get care and how to reduce your risk.
Their neurology and neurosurgery clinic offers expert treatment for conditions and diseases of the brain, spinal cord, and nervous system. Dr. Gurant Atwal joins us with more. Welcome to the show, doctor.
Pleasure. Thank you for having me.
So let's just start off with the basics. Can you describe what an aneurysm is?
An aneurysm is like a bulge or a balloon on a wall of an artery. In simplistic terms, think of it as a garden hose analogy. With time, it loses the structural integrity, and part of it can balloon out. And the concern is, it can burst.
I've always heard brain aneurysm, but when I was reading up on this, there's so many other places that these can occur.
Yes.
Can you tell us a little bit about where and what we need to watch out for?
It can occur in anywhere in the blood vessels on of the body. It can occur on one of the biggest blood vessels of your body, which is called the aorta. So people can have aneurysms on their aorta. They can have aneurysms on the other arteries that go to the other organs, such as the renal artery aneurysms. So they can form anywhere where there are big blood vessels that are supplying any organs.
I think pretty much everybody that's an adult now knows of some story where someone out of the blue suffered an aneurysm, where the aneurysm actually burst and they needed to be rushed to surgery. But there are various treatments, right, for aneurysms?
Correct. So the way we treat aneurysms, especially first and foremost, if somebody has an aneurysm that has bled, that's a medical emergency, get to the hospital. The way we treat aneurysms is that we can treat them endovascularly, where we treat them from inside the blood vessels, which are a little bit less invasive ways. And sometimes we have to treat them with traditional open surgery, where we have to make the incision and go into the cranial cavity and then treat the aneurysm that way.
And we talk about whether it bursts or ruptures. Is that when you're feeling that thunderclap headache we all hear about?
Yeah.
That's exactly it.
Okay.
That is one of the takeaway messages that we want to emphasize, is that when somebody has an aneurysm that has caused a bleed, it presents as the sudden, severe, worst headache of their life.
Okay.
A thunderclap headache like they have never experienced before.
I mean, if you do have an aneurysm, because I think we're under the misnomer that if you have an aneurysm, it's an aneurysm that burst, right? But does it always end up bursting, or do most people find that they have an aneurysm that just needs to be treated before, they find it before?
It's a good question. A lot of the aneurysm can be discovered for other reasons when people get imaging for other reasons. So not all aneurysms cause bleeding.
Okay.
However, when somebody does have a diagnosis of an aneurysm, then the conversation becomes is whether or not should that aneurysm be treated, and that is a complex decision-making process.
And I know some people are born with an aneurysm. You may not know till later in life, but can you prevent it?
Good question. So there are three things that we talk about with aneurysms. One is family history, or your own history of having an aneurysm. The other one is high blood pressure and smoking. And those are the two ones that we really emphasize to our patients, is that not only high blood pressure and smoking can lead to the formation of aneurysms, but if somebody has a diagnosis of an aneurysm, high blood pressure and smoking can cause the aneurysm to bleed. So those are the two risk factors that we really emphasize to manage very effectively in somebody who has a diagnosis of an aneurysm.
And Sarah mentioned that headache, that's the worst headache of your life, but then also kind of look out for pain maybe around the eyes too, you say?
So sometimes the aneurysms can grow to a large size, where they can start putting pressures on nearby structures like nerves. So people can have droopy eyelid, double vision, pain behind the eye, blurry vision, and things like that. When that happens, that's a sign that somebody should seek medical attention.
And if we come to you at that point at UI Health, what's the kind of comprehensive care that we would get coming to you at that point?
So as a comprehensive stroke center, we are able to provide high level of care because we have surgeons who are experts in treating aneurysms, both with open surgery as well as endovascular surgery. Additionally, we have teams which are dedicated to taking care of patients in the ICU after their procedures, like the neurocritical care team. We have our neuroanesthesia team who's dedicated to taking care of patients with these diseases during our procedures. And we have our nursing team who helps us take care of these patients on a daily basis so we can get the best outcome for our patients.
Incredible. State-of-the-art care there.
Thank you.
Yeah.
Thank you so much for being here. We appreciate it, Dr. Atwal. For more information, you can scan the QR code on your screen. Also, head to aneurysm.uihealth.care. Find them on the socials as well.